All right, so going into doing a composite filling, we're going to be doing a composite filling today on tooth number 10. We are going to do a filling to go and take out different portions or surfaces of the tooth, and we're going to restore using the composite procedure. And going from there, we're going to gain access through the tooth, through the mesial portion of it, extending through or coming from the facial to the lingual portion. Let's go ahead with our high-speed handpiece. Let's get drilling. Usually in this portion you're going to have an assistant to help you with suctioning. At the moment I'm going to turn off my water for now so that I don't ruin my visual of the tooth. Sometimes when your doctor is working, they may want to use certain instruments to go and click off pieces of tooth structure that may be lingering by, that they may want to be a little more delicate with, such as this mesial wall that touches the other tooth. So I'm just going to go and clear this out a little bit with my spoon excavator. And while they're in there, doc may want to go and check the tooth decay to see if they got everything. I'll go do a little bit of excavating with theirs. They'll go and check it with an explorer, make sure everything is gone. All the tooth decay is gone and solid tooth structure, no sticky feeling or anything. From there, they may provide undercuts by using 330 burrs or round burrs to be able to place retention points for the composite material, even though it may be chemically retained, they may put a little bit of mechanical retention in there. All right, from there you're going to go and get this tooth nice and dry and going in and using your saliva ejector to get any water from the back if there's anything left over. During this time, since we're going to be dealing with a lot of saliva, we may want to go and kink this over so that we can go and use it in the mouth and leave it there, just as so. Depending on your doctor, they may have access to that, or depending on your patient, they may not produce a lot of saliva to battle against you during this process. From here, we're going to go and place our moisture control devices. I'm going to go put a piece of cotton roll right above where this tooth number 10 is that I'm going to be working on, just to make sure that there's nothing that's going to leak onto the tooth. From that place, we can go a couple different directions. We may use a acid etch to go and create little microscopic holes in the tooth so that we can get really nice retention on it, and they'll just go and place that on the dentin and the enamel for a certain amount of time before we rinse and dry off. Another thing that you may have is going to be a primer and a bond. And a lot of times you'll go and put these inside one of these little mixing wells that we have here. And you will use whatever material you have, clear fill or some other type of brand that may be out there. You'll use a primer and a bond to be able to go to the next step. At the moment, we're going to go and start with some etchant. I'm going to place a little bit of etchant on the tooth, on the enamel, and on the dentin. And typically when this is placed on the tooth, a lot of doctors like to leave it on for about 10 to 20 seconds or so before you get a really nice rinse. At which point you're going to be ready with your high vac suction and a air water syringe to go and rinse it off. Real important to go and suction it as much as you can off with your high vac before you go and spray it with your air water and send it flying everywhere. So from there, let me go and rinse it after it's been about 20 seconds or so. Suction the majority out of the tooth. And from there, I'm going to go give it a good rinse. Real nice, like 5-10 second air and water spray. Get everything nice and dry from that portion coming from the lingual. Give a little bit of spray and air. Get all the other teeth nice and dry. Nothing left behind. If your cotton roll is now saturated with water from doing that irrigating or that rinse and drying, then go ahead and switch it out. At the moment this one is, so I'm going to go and switch it out to a nice fresh one. And from there, we can start moving over to a prime or a bonding situation. At the moment, I'm going to go and use some bond for my teeth. And for this, you can go and place it into your disposable dapping dish by doing just one small little drop over here into your dish. You don't need a whole pool of bonding, but keep it nearby in case you're going to need more later during the filling process. At which point you're going to take one of these bendable brushes. You're going to put a little bit of a bend to them so that it's a little bit easier for the doctor to go and place it. A little bit of material on the end of that bendable brush, and it's going to be placed right into that dentin and enamel. So we get a nice saturated area. This will not be left on for that long. Usually after you go and place it, you're going to go and dry it off and not rinse it off. You want to leave some of this little kind of filling glue on the tooth, so we're going to leave a little film on there. From what you can do is you can go and place your suction right behind it, and then the doctor or yourself will go and blow it off with air until nothing wiggles anymore, until there's no visual pull of bonding on the tooth. Just air from both sides. And in that situation, after you go and put bonding on it, you should be right nearby with your light cure. At which point we're going to put the light cure on the tooth. You can cure it for 10 seconds to 20 seconds. If you have buccal and lingual or facial and lingual side, then make sure to give equal amounts to both sides so that you make sure that everything is nice and cured. You may use one of the orange paddles to help prevent the light from going towards your doctor's eyes. You may use your hand to go in, over it so that it keeps the light only in the mouth so no ricocheting light comes out. Just don't stare directly at it. Take my light cure, put it nearby and to the side. Your doctor may go with a couple different methods, such as going over to a flowable to begin with and then ending with a packable, more of a packable filling material. At the moment, I'm going to start with a flowable material with the end tip on there. Make sure when you're looking at your materials that you have the right shade and where the shade may be located. Such as on this situation, my shade is C3. It's upside down, but my shading is C3 for this tooth. Not a lot of people are going to be this shade. Usually you're going to be somewhere in the A's, A2, or A2, A3, D2, D3 range. I'm just doing this as an example. In this situation, before we go and place our composite in there, we got to place a Mylar strip. And now my Mylar strip is going to look funny because, for the sake of this video, I actually wrote the word Mylar strip on there. Actually, it might be backwards. So what we're going to do with our Mylar strip is you're going to place it in between the teeth, right for this tooth hole, and we're going to place it just like we would do with top of Mylar. You're going to go and slip this right in between the teeth. If it's really resistant, you can go and wedge the teeth apart before you put it on. Get it nice and down. And once you get it all the way to the floor for that specific tooth, you're going to come back with a wedge and place this from the lingual side or from the buccal side, whichever direction the doctor wants it. Make sure when you're placing the wedge, it's going to be on the opposite side, not directly touching the tooth where the filling's going to go. I'm going to place this from the tongue side. It's going to go right through right where the gum, right where the gingiva is. Sometimes these can be a little bit of pressure, sometimes a little bit of pain. Depends on how much you need to actually push through there. And once I got that, firmly set it into place. And now if I wanted to test my mylar strip if it works, I can just fold it over the tooth without any obstruction from my wedge or anything. From that portion, I can go in there with my flowable material, if that's going to be where your doctor ends up starting with first. They may place a small layer of flowable before they go on to more packable material. Place a little bit of flowable inside of the cavity, or inside of this prep that we have here. And we're not trying to fill it all the way up, but we're trying to make a little small floor layer that we can connect to later on. At which point your doctor may be going with a more packable solution. And our packable is going to be this syringe that has more of a Play-Doh-like material inside. And you go and extrude some by twisting this knob over here off on the back end. You can go and place this nearby or on your dapping dish. You can go put it on your mixing pad, but you don't tend to need a lot. So don't go pushing out a lot. You can almost sort of gauge how much you'll possibly need for fillings the more you go and assist them. So with that, I got a little bit of my packable. Sometimes it's nice to go and have your overhead light turn to low, or have an orange light that will help protect the material from setting up. Because this is nice and fresh, I can go and use my plastic instrument to go and take some of this material and deliver it to the tooth. Your doctor may want it more in a compactable form, in a nicer packable form, such as they may want it like a little cigar that they can go place in there directly. They may want it in a small little ball to make it easier for replacing. So I'm going to go and start off just like so. I'm going to go move over my mylar strip, and slowly we're going to get this nice and inserted and hopefully packed in correctly. Now when you're using our filling material, you may want to have a little bit of bond nearby. Some doctors may go and may want you to put a little bit of bonding material on a bonding liquid on their glove or nearby on a mixing pad or something, so that when they go and rub their plastic or their instrument on it, it no longer sticks directly to, it doesn't have a stickiness to the composite material that we're placing there. It makes it a little bit easier to form without accidentally pulling it up and off. A really nice thing to have nearby also is have a 2x2 close so that we can go and wipe our instrument on that 2x2. So have that instrument, get it wiped, get any of the part that we do not need. I'm going to go and work on my lingual because a lot of my material came out of my lingual side. Get it nice and packed. A little bit of material there. Wipe. And when we're just about done, we're going to go and prepare to go and light cure once more. At this point, doctor will usually go and start rolling their mylar strip right over where the tooth that we were working on, kind of an indication that we're about to cure. So I'm going to go turn on my light cure, get this cured up on both sides, both the mesial facial, We'll do this for about 20 seconds or so from one side, and some will bleed off to the lingual side also. Don't forget to go and give a little love to the back side over here. Going through the distal, or going through the lingual side, you can see them coming up and it shines right through. Make sure that you get an equal amount of cure on all sides. It's not a bad idea to over cure if you don't remember how much you actually cured it. Usually about a minute for curing composite. At this point, I've cured about 40 seconds from both sides pulled together. So I'm going to do my last little bit here at the end. This may not be the end of placing this composite. There may be a little bit more material that needs to be inserted on there. There may need to be a second area of the tooth that we need to go and restore. At this moment, this hole is filled up, so we're going to go and take our matrix apart by pushing our wedge out to the tongue side. Once I get that out there, I can go grab it, and we can get this Mylar strip out and start seeing our results of our work. Usually ending, you're going to have a little bit of what's called flash of composite material, a little extra that sticks off and on the tooth, and you might not visually see it to begin with, but when you go and kind of scrape the tooth with like an explorer, you'll see little shells. You'll see a little shell of material that comes off that sticks to the tooth, and your patient will feel it, and they'll say, "What is that? Is that my filling?" And it is, but it's not the material that we actually need that's useful for the filling. So you can also take a little plastic, kind of give it a little bit of a gentle scrape to get all of the extra that doesn't need to be on there off. Now you want to be gentle because usually you're going to have the doctor is going to go and polish this up with their different finishing burrs. At the moment, I don't have a really fine finishing burr. I'm going to do a little bit of an adjustment with my diamond burr that I have right here, just to get a little bit of the extra off there. Gets a little bit off of the lingual side. You can go back with it and go into more of a polishing burr, which you can use a white stone. That's the typical standard polishing burr that we have for composite, but there are also pogo, there's pumice polish, there's different things that are out there that are specifically for composite also. I can just use a little bit of a white stone on a slow speed handpiece, or I can go and use a white stone high speed handpiece with a gentle touch. Go and polish up that lingual and facial surface so that's not rough to the patient and it matches the aesthetics of the patient's mouth. Don't forget to remove any of our moisture control devices. So I'm going to go wet this cotton roll before I go and take it out. And I'm going to go give it some nice little dry. Give it a little bit of moisturizing since your tooth's more likely dehydrated from the whole process of the filling, and then we get our result. Now in this situation I picked that C3 to go and match this, which definitely is not the best match, but it is something that I just kind of picked up on the fly, and it doesn't look too bad, but you can see where it is on this tooth. And if I go and kind of bring it in a little bit closer, let's see. Right about there, so you can see where that finish line is between the tooth, normal tooth, and the actual filling that we have on there, on the front and on the facial side and on the lingual side here. At which point, go ahead and lift up your patient, make sure nothing's left in their mouth, and then dismiss them. Tell them post-operative instructions. Usually people are always wondering if they can eat after a composite filling. They can, because the material is hardened completely from the light, but if it is a filling that goes and blocks the nerves on one side, usually the lowers at all, we tend to tell them to eat on the other side or eat soft until about 2 to 3 hours when the numbness goes away, and then they can eat. Just to avoid the risk of biting their cheeks or tongue or lips, because they can't feel it right now, but they definitely will feel it later. And that's it.